Well, joining us now is Africa 54 Health correspondent Linord Moudou. What do you have for us today, Linord?
Hello, Vincent. Well, the World Health Organization officials have called for the regulation of traditional medicine in Africa to protect the public against potentially harmful practices. Dr. Matshidiso Moeti, the WHO's Regional Director for Africa, has issued a letter urging governments to strengthen regulatory bodies for traditional health practitioners. She calls upon researchers to work with traditional practitioners to produce a scientific evidence on the safety, effectiveness, and quality of their products. The announcement could have broad implications for the estimated 80% of Africans who rely on traditional practitioners for their primary mode of care. Observers say many have no other options, as hospitals are often far away, expensive, or poorly staffed, and the consequences can be deadly. Now, a new article published in the journal The Lancet Diabetes and Endocrinology says diabetes now affects 21 million African men and women, a number that authors say is expected to climb to 35 million in the next 20 years. They estimate the prevalence of undiagnosed diabetes is 62% in middle-aged adults. Those younger than age 60 make up 3/4 of deaths related to the condition. Experts say the problem is tied to the social and lifestyle transitions now taking place in Africa, such as migration into urban areas without adequate green space and options for exercise. They point out that medical infrastructure and technologies in sub-Saharan Africa are heavily geared toward responding to communicable diseases such as HIV, TB, and malaria. The challenge is to make hospitals, clinics, and health personnel more responsive to the treatment of diabetes. A Tanzanian chemical engineer has designed an innovative water filter using nanotechnology to purify water. Dr. Askwar Hilonga says his filter can remove up to 99.99% of bacteria, microorganisms, and contaminants.
This is clean, safe drinking water.
Tanzanian scientist Dr. Askwar Hilonga says the water filter he has created is very effective. The new invention is now helping a section of Tanzanians get clean water. Catherine Nyanyaro is a housewife and lives in Arusha. She says the filter is also helping her save time.
Before I had this filter, I used to fetch water from the river, and sometimes I used it without boiling it because it is very time-consuming to boil the water. I had many problems, like typhoid and other diseases from the water.
The filter is tailored to absorb anything from copper and fluoride to bacteria and viruses. Gravity pulls the water down through a series of buckets connected by tubes. The buckets contain sand with a layer of good bacteria on top, which eat the microbes that contain diseases like typhoid. The magnetic quality of the sand kills other bacteria as the water filters through it. The final bucket uses nanomaterials to filter out any remaining microbes. Dr. Hilonga was inspired by a visit to his parents' village outside Arusha in Tanzania, where many people with no access to clean water suffer from waterborne diseases.
In Tanzania, 70% of households, of 9 million households, are not using any kind of a filter. That is how big the market is. That is in Tanzania alone. 9 million households. Then imagine in Kenya, Uganda, Ethiopia, Sub-Saharan Africa, India, and elsewhere. So the market is very big.
One filter costs about $140 and can supply many liters of clean water a day. The Blue Sky Primary School in Arusha uses it to quench the thirst of more than 70 children.
Well, we analyzed the water around, and we have a river like 50 meters far from here, and we saw that it was not healthy, that water. Then we took water from the government supply, but we also saw that it was not going to be healthy, and we want the best things for our kids, so we decided to buy the filter.
Dr. Hilonga hopes the filter will one day be used to help communities and villages across Africa access clean water. That's our Africa Health Report for today. Back to you, Vincent.
Well, thank you very much for joining us today, Linord. Be sure to watch for Linord Moudou every Tuesday and Thursday for the latest health news in Africa, right here on Africa 54.